this is our assessment for neck and heart. We'll do neck first. First, auscultate the carotids. You will need your stethoscope. Start with your diaphragm, and you're going to be listening for murmurs or swooshing sound. First your diaphragm, and then your bell, and then do the other side. Next is to palpate the carotids. Carotid is in the groove between the thyroid cartilage and the sternocleidomastoid muscle, so just very gently palpate your carotid pulsation, one side and then the other side. Reminder, never do both at once. That could create a vagal reaction and result in bradycardia or syncope. The next thing we're going to do is we are going to do our jugular pressure assessment. If you can lay down, sir. Remember to have your bed at about a 30 to 45 degree angle. It sometimes helps to have the patient turn his head slightly to the side, and you're going to assess for jugular pulsations. At 30 to 45 degrees, you should see no jugular pulsations. And next, we're going to assess for jugular venous pressure. The way to do that is to palpate for the sternal angle, which is about an inch below the sternal notch. Place your ruler at the sternal angle, and then look for the height of jugular engorgement, and take a card or another ruler and put it perpendicular at the level of where the jugular engorgement ends. Sometimes it helps to have tangential lighting for this to bring out the jugular engorgement. And that basically concludes the neck portion of the assessment. Next, we're going to assess cardiac. So if you could sit up for me again, please. And we're going to lower your gown, please. And first thing is to assess for any pulsations in the precordial area, any lifts or vibration. Next, palpate for apical pulse, right here with your fingertips. And also, although it's unusual, palpate in the apical area, right here, the left sternal border, and the base of the heart. Remember, the base of the heart is on top and the apex is down here. Once we do that, we're going to do our auscultation. Remember that there are 4 areas where you auscultate: aortic, pulmonic, tricuspid, and mitral. Take your stethoscope and start with your diaphragm first. Aortic, pulmonic, tricuspid, and mitral. Then use your bell and complete the same process. Aortic, pulmonic, tricuspid, and mitral. It doesn't matter whether you do your diaphragm and bell, or if you do diaphragm all and then bell all. That's up to you. So, do your first assessment with the patient leaning up, sitting up. And while you're assessing, count your apical rate and also take a radial pulse and do your pulse deficit. You should feel a pulse for every apical heartbeat that you hear. After you completed your pulse deficit, do your auscultation with the patient leaning forward. So can you lean forward? And you would, once again, do your 4 areas of the heart with the diaphragm and then with the bell. If you can sit up for me. And if you could take a deep breath in, let it out, and hold it. And then do an auscultation. Okay, breathe. That one has to be rather quick. And breathe in and hold out. And now we're going to do it with the bell. And the final step is left lateral position. So if you could lie on your left side, please. And then you would do your 4 areas. And that completes cardiac assessment.